It's actually been way more beneficial than I would have imagined at the time. At the time, it was just an opportunity that presented itself for me as a neurosurgeon to develop some expertise in the neurology of movement disorders and to really get some in-depth understanding of Parkinson's disease, and also to spend a few months with Michael at Emory, which is one of the centers, which at the time was the premier center in the United States for deep brain stimulation. So we got to sort of plan and scheme and develop our vision for the University of Florida Center before we came, as we spent those few months together at Emory. And like Michael said, I studied the neurology part at the time, and he was spending most of his time involved with deep brain stimulation surgery. And in the end, we understand each other pretty well, and we have similar ideas about how things ought to be done. And that, like I said, that has turned out to be a pretty powerful thing when around the country other neurosurgeon, neurologist teams that do what we do, you know, we joke about their marriages, and they're constantly breaking up because traditionally neurologists and neurosurgeons really don't get along. Most of the time we have different ideas about how things ought to be, and we've done pretty well now for a decade, so over that, longer than that now.
Yeah, it's interesting because, you know, when we were training, you know, to learn movement disorders and microelectrode recording, one of the things that was really important was we finished our training at the same time, at the same place, and we began to take things that were important and notice all the good things about the program that we were associated with, and we brought them back to UF. And then in our roles as visiting professors going around the world with people that visit us, and then in my role as National Medical Director for National Parkinson Foundation, I have to inspect 43 centers of excellence all over the globe. And so it really has given us an opportunity to look at what's exceptional about movement disorders and Parkinson's disease and DBS programs, and to bring it back to UF. And I think it really started early for us, just the idea of saying, hey, that's a good idea, but you know, more than that, we said, that's a good idea and let's do that. And then a few years ago, we said, hey, you know, we should build a center that does this, that's completely patient-centric and completely interdisciplinary and all in one place, and we could bring together all of the greatest things that there are to offer in this field to patients. And I think the idea of sort of bringing things and exporting things out started early for us.